First of all, I am discuss about the introduction of cataract. Cataract derived from Latin word cataracta, mean waterfall. In Greek, cataracts and cataracts. From cataracin mean to dash down, cata mean down, aracin means strike or dash. Cataract typically progress slowly to cause vision loss and potentially blindness if untreated. Now I am discuss about the cataract. In normal vision, vision is a result of interaction between different parts of eye and the brain. Here's the anatomy of eye. While a crystalline lens, the quality of vision depends to a high extent on the performance of the natural lens, also called a crystalline lens. This transparent and flexible body is located in the capsular bag behind the iris and is held in position by zonular fibers. A healthy eye. In a healthy eye, a clear and bright image can be seen when the light rays pass unhindered through the crystalline lens and focus directly on the retina. As you see, flower is focused on the retina in a normal crystalline lens, while in cataract, with age the crystalline lens becomes thicker and less transparent, preventing light from passing through the crystalline lens. This clouding of crystalline lens, called a cataract, leads to a gradual deterioration and, if untreated, to a complete loss of vision. While the causes of cataracts: ultraviolet radiation from sunlight, eye injury or previous eye surgery. Risk factors that increase your risk of cataracts include high blood pressure, diabetes, smoking, exposure to X-rays for a long time, previous eye injury or inflammation, prolonged use of corticosteroids, consume excessive amounts of alcohol. How are they diagnosed? To determine whether you have cataract, your doctor will review your medical history and symptoms and perform an eye examination. Your doctor may conduct some tests like slit lamp examination, via acuity test, and retinal examination. Here are the different types of cataract. This is the normal lens. I already discussed how light rays pass through the normal crystalline lens. I show you the anterior and posterior part of crystalline lens. Now I am discussed nucleosclerotic or nuclear cataract. This is the most common type of cataract, involves central or nuclear part of lens. Eventually it becomes hard and sclerotic due to congestion of lens nucleus and deposition of brown pigment within the lens. In early stages, increase in sclerosis may cause increase in refractive index of lens. This causes myopic shift that decreases the hyperopia and enables patient to see at near without reading glasses. This is the temporary condition and it is also called a second sight. Now here is the cortical cataract. It is due to the lens cortex become opaque, occur when the change in the fluid contained in the periphery of lens. When these cataracts viewed through ophthalmoscope or other magnification system, they appear white patch-shaped or radial spoke-like cataracts. Now I am discuss about the types of cortical cataract. First of all, anterior cortical cataract. Opacity in the anterior involves only in the frontal part of cortex of lens, as shown in this image. While in peripheral cortical cataract, opacity in the periphery and forms wedge-like structures. This is the peripheral cortical cataract. Now posterior cortical cataract. Opacity in the back part of lens but does not touch the capsule. Here is the posterior cortical cataract. Fourth one is the lamellar cortical cataract. Opacity involves the whole part of lens cortic except the cortical part of the anterior to the nucleus, as shown in this picture. Here are the 4 different types of cortical cataracts. Now I am discuss about the types of capsular cataract. First of all, anterior subcapsular cataract. Anterior subcapsular cataract involves opacification of the anterior and frontal part of the lens cortex, as shown in this image. Opacity is in the center and anterior part of lens. While in posterior subcapsular cataract, opacification in the posterior or back part of the cortex lens, as shown in this image. Opacity is just in the back part of lens. Now, anterior polar cataract. Cloudiness occur at outside the boundary of frontal part of cortex lens, as shown. And fourth one is the posterior polar subcapsular cataract. Cloudiness occurs at outside the boundary of posterior or back part of the cortex lens, as shown in this image. Now I am discuss the stages of cataract. These are the 5 stages of cataract. First of all, normal. Normal cataract, it is early cataract. Lens is still clear, but the ability to change the focus between the near and far vision has become to be compromised. In immature cataract, protein started to clumps, making it slightly opaque, especially in the center. In mature cataract, opaqueness increased to such a point that it appears milky or white. In hypermature cataract, is dense and impaired vision is significantly extended. Cataract is shrunken and wrinkled anterior capsule due to the leakage of water out of lens. While the Morganian cataract, hypermature cataract, in which totally liquefaction of the cortex has allowed the nucleus to sink inferiorly. Nucleus settles at the bottom. This is the first condition, while the second condition, calcium deposits seen on the capsule. Now I discuss the management of cataract. First of all, non-surgical management. Glasses. Cataract alters refractive power of the natural lens, so glasses may allow good vision to be maintained. Like dark glasses helps in such situations by keeping the pupil bigger. Second is medical treatment. To delay the progression of cataract, aldose reductase inhibitors prescribed like oral aspirin. Second, antioxidants like beta-carotenes or vitamin C. Membrane stabilizer agents like benzyl alcohol. Nestlines like iodides of calcium or potassium. And in surgical treatment, there are the 2 methods, ECCE and ICCE. ECCE is extracapsular surgery. In this surgery, removing the lens but leaving the majority of the lens capsule intact, while in ICCE, intracapsular surgery, removing the entire lens of eye including lens capsule, it is rarely performed. Phacoemulsification is a technique in which high frequency sound waves are sometimes used to break up the lens before extraction. So this is the end of cataract.